Vlad, thank you so much for joining this podcast. I always wanted to have you as a guest, and I'm really, really happy that you could make it.
Pleasure to be here, Dirk.
Good. Vlad, can you perhaps tell listeners a little bit about your personal and professional background before we go into mental health and Kyan Health?
Sure, happy to. So I'm a product of Eastern Europe. I was born in Romania right after the communist regime ended. And I finished high school there and then moved to Switzerland for university. So I have a background in economics and finance. And then I started my career in McKinsey as a management consultant, where I spent a little bit more than 9 years, almost 10 years, focusing on HR-related topics and organizational-related topics. Things like transformations, reorganizations, more strategic workforce planning. And that's where I also developed a real passion for people at work, not just work itself, but the people who do this best work.
Right. And when did you become personally interested in the topic of mental health?
So mental health was always an interest. It was as first an intellectual interest. My mother is a psychiatrist. We used to have dinner conversations about psychoanalysis, and there used to be, friends and colleagues who would join. And I always find that so thoughtful and so interesting that you could explore the depths of the human mind. And for me, that's, I would say, one of the unexplored frontiers of the universe, right? It always generated this like, wow, what if I could do this? Or what if I could learn what causes people to feel in this way, right? But very much of an intellectual interest. Then in 2019, it became a personal, let's say, exposure point. I dealt with a pretty intense period of anxiety, which culminated with panic attacks. I remember I was on the floor of my Singapore apartment at the time, thinking I was having a heart attack. And then I knew that I had to change some things in my life. I had to really act on this topic. It was a clear signal that things weren't working well anymore. And so I started looking at, how do I get support? How do I, address this? And I was very lucky. My mother was actually able to connect me with a great psychotherapist who helped me address some of these foundational questions that were driving the anxiety. And I was lucky. After a little bit more than 2.5 months, I was able to really feel back and my confident self and go back to full-time work. But that's when I also realized that there were signals and things I could have done. I could have prevented this earlier. I think in the months preceding these panic attacks, I had changed my behavior quite significantly. I wasn't sleeping anymore. I was neglecting my needs. I wasn't working out. And so I really realized that prevention is a lot more effective than the cure, right, when it comes to mental health.
And how did you turn those personal experiences into professional activities? First in a consulting firm when you worked, and secondly in founding Kyan Health.
Yeah. So it started with, I was gone for 4 weeks on a sick leave. And how do I tell this to other people when I come back? I didn't want to make up a lie or tell them something that wasn't true. So I filmed a short video. It was a 3-minute video that factually recounted my experience with this period of anxiety. From, the 6 months before, some of the signals that I saw, to the actual crisis moment, and then the recovery period. And I was expecting this to be, just a random thing that I put out there and will share the link with people who asked me where I was away for 4 weeks. And it became viral. I think there were more than 300 people who reached out and said, I'm going through exactly the same thing. I have no clue what to do. I don't know where to get support. Is this the end of my career? How do I tell, the partners I'm working with about this? And what is an effective way to deal with it? How do you get back from it? Right? These are really the deep questions. And I realized that there was a gap in the solutions and the support that people thought they could get. Right? And that's when I wanted to really go deeper into this topic. And this coincided with the first wave of the pandemic, where pretty much everybody in the world was, going through the biggest change in their lifetimes. So, of course, that impacted everyone's mental health. And I was asked to lead the global mental health program for more than 30,000 people. In doing so, I realized we already had some solutions in place. There was an employee assistance program, but most people didn't know about it. So there was this awareness problem that we had to address.
Yeah.
And then there was a cultural perception problem. People didn't want to feel like they were calling a psychologist because something's wrong or they were sick. And so we had to really rebrand this whole thing into something that people felt passionate about and that they could use to become better. So I did that for about a year and a half. And in doing so, I interviewed also the biggest mental health providers in the world, companies from the US who have been working on this topic for decades, and realized that there was a real gap in the market. To put it in numbers, about 50% of employees are dealing with chronic stress at any point in time. Chronic stress is essentially the thing that leads to burnout. About a quarter of employees say that they feel acute symptoms of burnout, according to a study by McKinsey. And then if you look at the numbers of people who actually call these employee assistance program, that's typically 2 to 4% in an entire year. So there's a huge gap between the demand and the actual usage of existing tools.
Yeah.
Anyways, I basically set out to first find the best provider for McKinsey internally, and then also looking at other clients in the market that we were connecting with, and realized that while US was quite well, let's say, served by local providers, Europe wasn't. And in January 2021, I decided to leave McKinsey and create an enterprise grade solution that would essentially bridge this gap and would allow the largest multinational companies headquartered in Europe to support their people with the best quality solutions.
Right. And that was the moment that Kyan Health was born.
That was the moment that Kyan Health was born, exactly.
And can you describe in very simple terms what the concept of Kyan Health is and the benefits it delivers both for organizations as well as for the employees working in these organizations?
Well, you actually just explained the concept. We have to do two things well: organizations and employees. Traditionally, the focus was on the employee, right? It was the idea that if you experience a mental health challenge at work, something's wrong with you as a person. And we're going to give you access to a hotline and you figure it out. When you're ready, you come back. That doesn't work. You can have unlimited access to therapy, meditation apps, the best coaching in the world. If you're working in an environment that isn't right for you, let's say a toxic relationship with your manager, no amount of therapy can solve that. Right? So in simple terms, what do? On the individual side, we provide access to confidential, evidence-based tools that people can use to build strength, to build resilience, as well as to get support when they're struggling. Right? But also on the organizational side, we use data and capability building programs to create healthy organizations, a psychologically safe environment where people can really do their best work. That's fundamentally what we do. And what makes us really different from other companies in the marketplace is we have a real focus on the organizational part. Right? And I would venture to say that clients who have worked with us found it transformational for their culture and for.
So what you're actually saying is that there's a kind of value comes from multiple dimensions, right? It provides, let's say, data on an organization level, which enables the organization to take measures on corporate and organization level, as well as, let's say, it delivers a lot of data for individuals, which enable the organization to, through you, create kind of specialized help and individual support. So that's actually quite powerful. So can you tell us something about the results that you obtained for certain clients?
Yes, of course. So we first track engagement. Right? It's the number one thing. If you don't have any engagement, you can't make any difference. If no one uses the tools, then that's it. It doesn't work. So the first thing we see, between 20 to 40% of employees actively using Kyan Health. And I don't just mean, going on the app to sort of check the lunch menu if that would be available there. That's not going to change people's well-being. It's funny, but, a lot of our other companies in this space, use these type of hacks to drive up engagement, but those don't work, right? So when I say engagement, I talk about people coming into the app, completing their own self-assessment, interpreting the results, and then using one of the tools or being connected with a coach. That's what I mean. That's what drives individual well-being forward, right? So we get between 20 and 40% of employees to actively engage with these tools. Now, to put this in context, an EAP, as I mentioned earlier, engages 2 to 4% of people in a year, 10 times more people in an organization getting the support and the care that they need, right? That's the first thing. The second thing, when we look at how do well-being outcomes improve over time, we see that about 40% of users see a significant increase in energy. That means people who have used the app feel more energetic about their job, feel like they actually can perform better at work as a result of this support, right? And we're right now starting to go even deeper than these assessments. We're looking at what is the impact that we're having on absenteeism, on the number of sick days that people are taking. What is the impact that we're having on mental health related attrition of people who are leaving the company, and then in the exit interviews they say, well, it's just not the right place for me because of, it's not healthy, right? That's an indicator that the company is losing its best people. And then finally, presentism. What's the impact of people do showing up to work and trying to work, but just not being very productive because they're struggling those days. So these studies are ongoing right now with some of our existing clients, and would love if you invite me once again to come back and really share the data that's coming out, because it is quite exciting.
We'll definitely do that. And but to take a completely different track, it's a fascinating story, because you basically used your own situation and your own experiences to build, a company, a completely new company, a real startup. And I assume finding and managing a startup must be, quite hard and also formative work. So in this context, I also have a couple of questions. If you were to found a new startup, which 3 things would you definitely do again?
I think that the most important thing with finding any startup, and I did my fair research when deciding to take this route. The most important thing is finding the right co-founding team.
Mm-hmm.
And you don't get to choose your family, you don't get to choose your brothers, but when you build a startup, your co-founders are your family, and you actually spend more time with them than with your family. And in all honesty, right? And I'm somebody who works in well-being and actively try to manage a healthy life, but you do spend a lot of time working. And so picking the right people and really making sure that it's not just nice in the beginning, but really you test that relationship up front, and you really see how people react. That's super important. So really co-founding team, it's fundamental. Second thing is picking the right topic. And by right topic, I don't mean necessarily a topic that your clients are excited to pay for right now. That's part of the analysis. But I mean more a topic that you don't just feel a little bit passionate about or motivated because you read somewhere that it's something interesting and you want to be an entrepreneur, so you're just going to pick that topic. It needs to be deeper than that. Building a startup is so hard. It's taking no after no from your clients, from investors, from pretty much everybody, right? You're literally building something completely new, and the world doesn't want it or need it when you want to build it, right? And until it does, you have to deal with a lot of rejection. So if it's a topic that you don't feel fundamentally really passionate about, that you don't have a strong conviction level personally, you'll give up. And that's just actually the rational response, to give up to something that is so hard, unless you fundamentally find that conviction for this topic. So finding a topic that you feel personally, attached to beyond just, an idea is really fundamental. So team, topic, and then the third part, I'll be fully transparent. You can't do it alone, or at least my view is you can't do it without funding. I think if you're an entrepreneur starting from university, it might be a bit different, but I started Kyan when I already had a family. And so we needed funding early on, and we were extremely lucky to find investors who believed in us and who would also give us the trust and the autonomy we needed to make decisions and build a company in its early days. So being really mindful about who do you seek and take funding from? What do they actually mean when they say they're founder friendly, right? How do they express that really, right? If somebody's asking you for reporting every week, and challenging you on your numbers, and you end up spending half your week working in Excel to report for investors. Newsflash, that's not founder friendly. That's founder wasteful, right? And so really digging deep, finding what the philosophy of the fund really is, speaking with other CEOs, entrepreneurs who've raised money with that fund is fundamentally important. That's how you found the right partner, when they're excited to be on that journey with them. So yeah, founding team, working on the right topic that you feel deeply passionate about, and getting funding and financing from investors you want to be friends with, or be in a relationship for the next decade, I would say.
And moving on, let's say to a different aspect, which are the three things that you would do different if you were to ever do a startup again?
Yeah. So we started Kyan Health in 2021, which was the second year of the pandemic. The world was already working fully remotely, and we started as a remote first team. We have now people in more than 7 countries. We have an office in Zurich and an office in Berlin. Building a company up front, it requires culture, requires energy, requires drive, and all of those things flow top down from the founding team. And I think it was maybe more difficult than I would have expected to create this energy, drive, and culture while being fully remote. So I would say we would probably start with having everybody in one city with an office, and then really sort of giving people flexibility from there. But at least we had a home base to begin with. I think that's important for any entrepreneur who is considering building a startup today. I think the fully remote model, it's something that works for large organizations who already have things, all the processes, everything ongoing.
Yeah.
I think it doesn't work to be fully remote in the early days of a startup. I think that's number one. I think number two, we already had a very good idea about the product that we were building, and that worked against us. I'll be fully transparent. I had been on this topic for more than 2 years. I felt I understood the pain points of our clients because I had worked with several of them. And we perhaps jumped the gun too quickly into building the MVP without fully testing with our clients, with prospective clients, what they wanted to buy, right? So in hindsight, I would build a pitch deck even earlier, go and speak with prospective clients, even offer them to buy the product when it wasn't ready, and say it's going to be ready in 6 months, right? Getting that more feedback up front to avoid building things that they might need. Thankfully, we were able to still get it early enough, and we built the product that they wanted. And the third part, I think it's about differentiating versus competition. Now, we are in a very competitive market, right? If you sort of Google mental health solutions in Europe, you will see a lot of companies that are buying ads on some of those topics, right? And I think having a very clear competitive differentiation early on that makes you stand out is absolutely essential, right? And I think we started building that maybe a bit late. Now we have a very clear competitive differentiation versus our clients. We are the only multilingual provider that can support global enterprises, right? We have more than 25 native languages, and these are not translated. It's like having 25 native apps that people can navigate in Serbian, in Japanese, in Urdu, right? And we see that a lot of our clients have now started using Kyan as their one global solution that has all of these meditation apps in there. It has more than 400 hours of cognitive behavioral exercises. All of these tools in a single place, right? But it took us a while to really crystallize what our USP is. Yeah? And so I would try to do that a lot earlier, and also learn from the feedback we get from our clients.
And as an entrepreneur, who are your role models?
That's a very good question. And I have to be honest, this does change quite often. I think, to name a very sort of, you commonly mentioned one, Steve Jobs, I think plays a huge part in inspiring any entrepreneur. And not just in delivering a kick-ass product, but also in inspiring a culture of excellence. So, maybe it's a little bit cliche to mention him, but I think anybody who doesn't in the background still has him there. So for me, that's probably one entrepreneur that I see as a North Star of building things.
Yeah. No, I agree with you. I mean, the thing that I admired in Steve Jobs always is the fact that he had a strong idea of the concept that he wanted to deliver, and he basically drove it sometimes, to extreme, but basically deliver that vision. I always say that there's a clear difference between this thing and anything else that the competition builds, and it's because it's a very, very straightforward concept. And any other role models that, because you said it switches over time, any other role models in specific stages of your entrepreneurial career?
Yeah, so I think I read a book that was really foundational when I switched from being a consultant to being an entrepreneur, and it's 0 to 1 by Peter Thiel. Also, a very common book that I would recommend any entrepreneur should read. So Peter Thiel was basically the founder of, oh, you have it there. Great. So I think most people listening to your podcast would know about it, but it really was foundational for me in building this entrepreneurial mindset, right? People won't switch from from the current ways of doing things for a marginally better solution, right? Elon Musk, right? When he created Tesla, if it was just another electrical car with like slightly better mileage, or not mileage, but autonomy, people wouldn't buy it. So he started with the coolest possible roadster electric car that you could get, and got people emotionally excited about the product, right? That's one thing that Peter Thiel talks about in his book. Is like, what is this 10x factor? What's the thing that's going to drive so much excitement about your product that they're going to forget about any other existing solutions, right? And so I think probably in Peter Thiel's book framed it more clearly than anywhere else I had seen this. And I've had quite a bit of interaction with entrepreneurs and investors from Silicon Valley who share that mindset, right? So the second person I would name is Peter Thiel for just that one very important insight.
Thank you so much. Vlad, we discussed extensively what the importance of mental health and the possibilities to address that. We discussed your company. We discussed what it means to co-found a startup. Any final words of wisdom or anything you would like to share at the end of this interview?
Yeah, so I would say just maybe message to your audience. If the topic of performance, if getting more out of your people and creating an environment where you can do the best work is something that is relevant and meaningful. And I'm a bit cheeky asking this question because I know the answer is, of course it is, right? Everybody wants more than that. Then I would invite you to switch your mindset from mental health as something we don't want to talk about, from something that's keeping our people back, into mental health, and positive mental health is what helps our people do their best work. To be even bolder, when you decide that you want to be a high-performing organization that really delivers awesome products and services for your people, that's when you decide to take the topic of your people's mental health and well-being seriously. Right? And maybe to illustrate this, let's go back in history, right? When in the industrial evolution started, we try to get as much of people in a fairly unsafe environment, right? We had workers sort of digging for coal in mines, and accidents used to happen in the work all the time. And it was just part of doing business. But we didn't just accept it. We got smarter about it. We started creating health and safety policies that literally saved lives. We got people to wear helmets. We created devices and tools and services that supported health in the mine, right? And these days, we no longer work that much in mines. Most of the work that we do is with our minds, and we use our creativity, our ability to do best work and to do knowledge work most days. But we somehow accept that mental health challenges in the workplace, like burnout, are just the cost of doing business. And it's really fundamentally my mission to change that. I want to live in a world in 20 years where workplace-related mental health challenges are a thing of the past. And I really think we can get there. I think we can get there by taking an active stance to positive mental health at work and really embedding these tools, solutions, behaviors, policies in the workplace.
Thank you. Thank you so much for this interview, Vlad.